questions related to the meeting, but just very quickly, have you heard anything about what you're at 6:29 for the trees?
I've heard so many things, all of which are contradicting one another. So I really don't know. What I have heard is that as recently as this morning or early this afternoon, they were still in Cabinet Priorities Committee fighting about it.
Well, let's flip that around a little bit. What would you like to hear at 6 o'clock?
I can answer that question. Well, what we need now, it's clear that things are bad. Our ICU numbers are at record levels, and so it's time to take some real action. And so if we want to avoid business closures, and I think we all do, then what we really need to do is implement a mandatory vaccine passport immediately. We need to tighten up the provincial mask mandate so that it includes schools and places of worship, and is a bit stricter. And we probably need to go back to some gathering limits on indoor and maybe even outdoor gatherings. But ultimately, I think our goal needs to be to keep businesses open, keep schools open, and these other prospects hopefully will be able to flatten the curve if it's not too late, while keeping those businesses open.
How can a vaccine passport help with the proposed proof of vaccination for city services?
Oh, well, it would solve the problem. Because if there was a mandatory vaccine passport, then that would have to happen.
So you would just lean on that?
We would just use theirs, and every organization in the city would, so presumably it would be easy to do. I should say that this morning, I wanted to just look up some lab results, and I could not get into the eHealth website or the eHealth app. Well, I could get in, but there was a long queue. So I sure hope that site is ready for the volume that it's going to get when people try to download the paper cards tomorrow.
So if that list of yours, if all of those things don't come to pass, or some of them do and some don't, given what we're seeing in the numbers and the test results, percentages, what do you foresee?
Well, even if they do what I'm suggesting, it will still take a while to slow down the curve. So I happen to have an appointment this morning at Foothills Hospital. And so me being me, nothing scary, just routine, but me being me, I asked all the workers there how they were doing and what was going on, and oh man, did I ever hear an earful, and of how nervous they are about the capacity of the healthcare system to manage. So, given that, we really have to take strong action, and we have no time to waste. We've wasted too much time already. So it's important that this go forward. I'm hearing rumors that they're looking at a way to finesse it because they hate vaccine passports. And for some businesses, it'll be optional, but if it's optional, then that business runs the risk of being closed. I mean, this is silly. We already know what the policy right answer is. Many other provinces have done it, and the province just needs to admit they were wrong and get on with it.
So if they only go with one of those, what the rumor is that they'll go and it'll be kind of an optional thing. What will the city do then?
I mean, we probably will look at implementing that in our own facilities. But I will highlight that's useless. And one of the things that this government is well known for is they announce something silly that everyone knows isn't going to work, and a week later they show up and go, that didn't work. Let's not do that again. We've seen that movie. It wasn't good the first 4 times. I don't want to see the 5th sequel.
The provincial officials' political desire, thinking about what in the future is standing in the way of basically doing what's needed to help Alberta through it?
I mean, look, I don't know, but if I were a politician worried about re-election, which thankfully I am not, and I knew that 77% of Albertans want a vaccine passport, then it would be awfully silly of me to listen only to the remaining 23%.
Why wouldn't the city just go forward with their own? Wait on the province to do something, dereliction of responsibility, why not just...
On this particular issue, vaccine mandate for city facilities, really it's a question of cost and overhead. We wouldn't want to, unlike the province of Alberta that forever wants to create their own thing, for us to create our own thing, because you go to a place like Inglewood Pool, and there's only 2 staff members there. 2 lifeguards, one sits at the front and one overlooks the pool. And to add to them a big process would be hard. Now, if there's a QR code, if there's just a thing where your app turns green if you're vaccinated, that would make life much easier, but we need that backbone in place, and it doesn't make sense for the city to create that from scratch. We also don't have access to people's health records.
What about something broader? What about mandates for facilities that aren't city facilities? Is there anything you can do?
No,
It's
I'm gonna
not
ask that,
private
I'm gonna
business.
ask that question to, when we get to this item. My sense is that we don't think so. But certainly if the province really and truly doesn't act, there are provisions of the Municipal Government Act that talk about our duty to protect the safety of citizens. And I'd certainly be willing to take that risk. You know, the problem is, of course, we're in an election period. At some point, midnight tonight, midnight tomorrow, I will bang the gavel, and that'll be it for this council. I can call them back if I need to, but you know, I shouldn't have to. A well-functioning provincial government should have had this all sorted.
Is this a well-functioning?
No, it is not. And it's very frustrating to me. You know, I am very nonpartisan. I have had 6 premiers, 2 prime ministers. I have worked with dozens of big city mayors, some of whom were embroiled in scandal and lots of trouble, and I have never seen a government this incompetent.
Is it frustrating to have to be weighing into these guys right now?
Well, it's frustrating to me as a politician, but it's not about frustration or my frustration. People are dying. Families are going through immeasurable grief and pain, and this could have been avoided.
It's more of a city manager question, but maybe it'll be discussed later. You know, the city's operating its facilities at 33% capacity. Is there any discussion or thought about rolling that back and having maybe more city workers go home and work again?
No, we probably are at close to the maximum of people who can work at home. The vast majority of my colleagues in the city have jobs you can't do at home. They drive buses and garbage trucks. They're first responders. So the folks who are actually coming into the office, it probably is fine, given the size of the facility. So I don't think that would have much impact. All right, thank you.
Thanks.